In many families, the issues about ADHD may be more than just about ADHD in a particular child. Given what we know about genetics, it's likely that if a child in a family has ADHD, that at least one, if not both, of their parents may also be dealing with the same issues. So in that way, ADHD kind of is a family affair. A parent may also be struggling with issues of attention, organization, concentration, and addressing the issues at the parental level is very important. In a family where a parent is also dealing with issues around ADHD, there's a lot more at stake. Since a parent is really the one that sets the tone for the organization and structure of the family, whether it's calm or chaotic in a family. And if a parent isn't aware of and dealing with their issues in an appropriate way, it makes it very difficult for them in a parenting role to do the things that they need to do to help their child manage their condition. It's really easy for parents to focus so much on their child that if they are struggling with similar issues themselves, they can easily get ignored. And a parent really needs to understand that they need to put themselves first in that case, take care of themselves in order to help their child. It's kind of like an analogy is sort of like that announcement you hear when your plane's getting ready for takeoff. You know, in the event of emergency, these masks are going to drop down. Make sure you put your mask on first and get the flow of air going to yourself before you try to, help your child get their mask on. So it's the same thing with ADHD. When a parent has ADHD, take care of yourself, put yourself in the best position possible to be able to help your child. As a parent, in terms of taking care of yourself, if you're struggling with issues around ADHD yourself, it's important to make sure you get yourself evaluated, determine whether in fact, you do meet the criteria for a diagnosis of ADHD, and if needed, to start a course of treatment, whether that's counseling or medication or some other type of support that's going to help you function better in your parenting role. In many ADHD families, there's one parent that is sort of dealing with those issues and one that might not be. And it's really important for parents to really strengthen the relationship between them, to develop some clear expectations of what each other's strengths and weaknesses are, to help them work effectively together as a team. For example, if you're the parent with ADHD, one of the tasks that you might not want to take on in terms of running a household, you might not want to be the one that's responsible for organizing and paying the bills. There might be other things that you do better, and leave that kind of thing to your partner. Marital counseling can be helpful to families where a parent has ADHD. Can create a safe environment for the parents to be able to talk to each other about their expectations about each other, how to collaborate best with each other, and how to deal with the issues that are directly a result of ADHD, the organizational problems, the attention problems, and how those impact them as parents and in organizing and running a family. In families where parents are functioning differently, one may have ADHD and one may not, it's really important that parents don't fall into the same roles all the time, that one's not always the good cop, one's not always the bad cop, that they work out ways to collaborate and parent so that both of them are involved as much as they can be in all the tasks of parenting. While that may be different for the parent with ADHD versus the one that doesn't, again, trying to achieve some measure of balance so that you don't get pegged into the same roles all the time can be really helpful. In any family, consistency and structure is important. In a family where a child has ADHD, it's even more important to establish routines and ways of functioning that are consistent and structured. In a family where a parent and child both have ADHD, it becomes many levels more important to make sure that routines are consistent, that expectations are clear. This takes a lot of effort on the part of a parent, but it can really, that effort, when that effort's put in, it can really go a long way in helping a family function better.